EVA Total Mobile Lift is a lightweight, versatile, aluminum lift that is perfect for all lifting situations, especially for heavier patients. The EVA is the lift of choice for the totally dependent patients and can lift from a seated and/or supine position to transfer to a chair, commode, stretcher, toilet, and wheelchair. The EVA is also capable of lifting a patient from the floor. In this video, we will discuss the operation of the EVA lift, including assembly, operation, safety checks, troubleshooting, as well as care and maintenance. System Rometic includes 3 models with a weight capacity of 400, 450, and 600 pounds. The EVA lift is available with electric boom and electric leg widening. In this video, we will primarily discuss the EVA 600 EE, and we will demonstrate the various slings and accessories, including the ambulation arm for gait training. The EVA is made up of 2 main sections: a lift assembly with attached actuator, control box, battery box, sling bar, and a base section. The EVA requires a 3mm Allen wrench to attach the control box and 2 wrenches, 13mm, to attach the handles. Let's begin by placing the mast into the bracket on the base. The mast can be positioned at 3 different levels. The most widely used position is the highest position. Secure the mast in the base by passing the long locking handle through the bracket and mast. Then use the other locking handle to snugly tighten the bracket around the mast until the mast is tightly secured in the bracket. Next, locate the small Allen screw and the control box. Attach to the bracket on the front of the mast using the Allen wrench. While facing the control box, connect the operating cables. First, locate the hand control and insert the plug into the leftmost socket until the flange is slightly recessed into the socket. Second, locate the cord attached to the mast actuator and insert the plug into the middle socket until the phalange is slightly recessed into the socket. Third, locate the cord attached to the base actuator and insert the plug into the right socket until the phalange is again slightly recessed into the socket. Now, place the battery box about 1/4 inch above the control box as close to the mast as possible and slide the battery box down until it clicks into place. Then, mount the charger cable holder cap on the top of the battery box by pressing down until it snaps into place. In this section, we will briefly review some of the operational features of the EVA, including the hand control, charging, emergency stop button, emergency lowering, and wheel locks. Before using the EVA, all operators should carefully study and understand the instruction guides for both the lift and accessories, as well as complete the EVA competency checklist. In addition, the patient care plan should be reviewed for patient's activity level and any contraindications for using a lifting device. Assure that the use of the lifting equipment and accessories are in full compliance with the patient care plan. The EVA hand control is used for lifting and base width adjustment, and the arrows on the buttons show the direction of lift movement. Buttons must be held down for the lift to operate, and when the buttons are released, the lift will stop. In general, charging is recommended anytime the lift is not in use. This will ensure that a full charge is available when needed and will result in maximum battery life. The battery can be checked for charge status by visually examining the built-in battery unit indicator screen on the control box below the red emergency stop button. 4 bars indicate that the battery is fully charged. Each bar represents a 25% charge, so that when only 1 bar is remaining, the charge status is at 25%. The battery charging unit will beep when the unit has less than 25% charge remaining. Lock the wheels of the EVA lift when plugged into a wall outlet to prevent damage to the plug, cord, and control box or wall outlet by inadvertently moving the lift while still being plugged in. First, unplug the coiled cord from the wall outlet and then unlock the wheels. For safety reasons, battery charging should never be done in a wet environment. To begin charging, the emergency stop button must be in the out position. With the built-in lift charger, take the coiled cord and plug it into a regular wall outlet, and then check that both LED lights on the control box are lit, signifying that the battery is receiving a charge. The green LED light indicates that the charger is receiving power, and the yellow LED light indicates that the battery is charging. In case none of the LED lights light up, first, check that the red emergency stop button is not pushed in. In case it is, Gently rotate the emergency stop button to the right until it pops out. Second, pull the coiled charging cord out of the box and firmly reset it. If that does not correct the issue, then check the outlet or use another outlet. Charging stops automatically when the battery is fully charged. While the battery is being charged, the lift will not operate. When using the optional wall-mounted charger, remove the cord holder cap from the battery. Next, remove the battery box from the control box by placing the palm of your hand on top of the battery box and using your fingers to pull up on the locking latch to release the battery box from its bracket and then pull it out. Now, place it on top of the wall charger. There are 2 LED lights on the wall charger. The green light indicates that the charger is connected to the power, while the yellow and orange light indicates that the battery is being charged. Make sure the LED lights on the front of the charger are lit. Normally, charging takes less than 6 hours, and the charger will shut off automatically. Emergency stop is accomplished easily by depressing the red button on the control box. The emergency stop switch disables the entire lift and stops the built-in battery charger from operating. To reset this, turn the battery button gently to the right until the button pops out. During transportation, or when the lift is not going to be used for some time, it is recommended that the emergency stop button be pushed in to preserve the battery charge. In the rare case that emergency lowering is needed, it can be accomplished in 2 ways, electrically and manually. To electrically lower the lift, use a ballpoint pen or similar to push the round, soft membrane to the right of the emergency text on the control box. To manually lower the lift, turn the round plastic knob on the actuator clockwise. The wheels on the EVA may be locked to inhibit movement. To lock the wheels, step on the brake provided on each rear wheel. To release the wheels, press on the release mechanism. The EVA lift should only be used on flat surfaces, and the patient should never be left unattended. In general, the wheels of the EVA lift should not be locked, but allowed to shift position in response to the center of the gravity of the person being lifted and the lift. For safe and trouble-free operation of the EVA lift, there are some routine procedures that should be performed prior to each use. Visually inspect the lift and check for external damage and wear. Check that all bolts and joints are tight. Check that the latches on the sling bar are present, movable, and hanging vertically. Check the hand control and make sure it corresponds with lift and width movements. Check the emergency lowering and emergency stop functions. Visually inspect the sling for tears, excessive wear, and damage to the fabric, seams, loops, and straps. If the EVA does not operate when the hand control buttons are pressed, then check the following. Check that the emergency stop button is not pushed in. Check that the EVA is not plugged in for charging. Check that the charging bars on the control box indicate 25% or higher remaining charge. Remove and firmly reseat the hand control cable that is connected at the bottom of the control box, located to the left as you are facing the control box. If the mast does not operate, then remove and reseat the mast cable located between the hand control cable and leg widening cable. If the leg widening does not operate, then remove and reseat the leg widening cable located to the right of the middle mast cable as you are facing the control box. For all other troubleshooting concerns, contact your maintenance or biomed department. If not available, contact your local distributor or call the System Romedic National Service Center at 866-276-5438 or by email at customerservice.usa@handicare.com or info.usa@handicare.com. Slings should be wiped down using a quaternary compound and left to dry thoroughly. The slings can also be washed in 140 to 176 degree Fahrenheit water with a mild detergent and no rinsing agent. The use of chlorine bleach will damage the material and reduce the life of the sling. The sling should be air dried if possible, as tumble drying will result in damage and increased wear. Routine cleaning of the lift should be done with common surface disinfectants such as a water-based ammonia compound or quaternary compounds. Do not use products containing phenol or chlorine, since the nylon parts may be damaged. Assure that the wheel casters are free of dirt and hair. The EVA lift should be thoroughly inspected and serviced when needed, and at least once per year. Perform complete weight test and pay particular attention to the parts that show wear, such as joints, bolts, welds, and wheels. Service must be carried out according to the System Rometic Service Manual and by authorized staff. Repairs and maintenance may only be done by trained and certified personnel using original parts. When storing, keep the lift at a temperature above freezing and at a relative humidity of no more than 60%. Taking the time to remember these simple procedures will pay off in years of safe and comfortable lifting for you and those you care for. If you have any questions or comments, please consult your local distributor or System Rometic specialist.